Hi, I'm Linda Leskowski-Jones, and I am a nurse. In my role as editor-in-chief of Nursing 2022, I assure that Nursing 2022 offers content to elevate nursing practice, inspire nurses, and energize nurses to make the most of their nursing careers. I am actively involved in several professional organizations and boards to impact change, improve patient care, and support the profession.
Hi, I am Margie Smith, and I am a nurse. I am the manager of our COVID Resource Center, which offered COVID testing, COVID therapies, and COVID screening for all of our employees at the hospital. I also assist infection prevention with CLABSI and CAUTI rounds and hope to prevent them and keep our numbers in check and prevent them from happening.
I'm Karen Innocent. I am a nurse. At Walters Clore Health, I lead the Learning Experience and Accreditation Department in creating continuing professional development programs for nurses and other health professionals. I also put my nursing skills to work as a volunteer. I volunteer at Walters Clore Health's U.S. Wellbeing Program and for the American Red Cross as a blood donation program coordinator.
I am Vicki Cantor. I'm a nurse who develops evidence-based orientation materials for novice nurses because it's critical to get it right from the start. I am a nurse who's been contributing to the COVID-19 vaccination efforts at my local pharmacy.
My name is Robin Coyne. I'm a nurse who works to ensure consistent and correct practice and a culture of safety by staying on top of the latest recommendations and evidence and conveying this information to nurses through my work. I have also worked as a bedside nurse, a nurse practitioner, and in an educational capacity.
Hi, I'm Wendy Palma. I am a nurse. I work on the front line caring for COVID and other critically ill patients. I present at national and regional conferences on best practice strategies. I volunteered at the American Diabetes Association camp to ensure type 1 diabetic children can have an enjoyable, safe camping experience and not worry about their blood sugars.
Hello, my name's Ann Dabber Woods, and I'm a nurse. I am the chief nurse of Walters Clore Health Learning Research and Practice. I'm also adjunct faculty for several universities at the graduate level, and I am a critical care nurse practitioner for Penn Medicine Chester County Hospital.
I am Roseanne Rosso, and I am a nurse. I am the Chief Nursing Officer at New York Presbyterian Weill Cornell Medical Center. And that means that I lead the nursing practice for 3,000 nurses who work here. But what I focus on is creating the best work environment so that all of those nurses can be the best that they can be.
So my name is Jessica, and I am a nurse. I am a certified registered nurse anesthesiologist. I am the one that greets you when you are going to have anesthesia for surgery or a procedure. It is my honor to take care of you from the moment we meet through going to sleep and waking up. And it is a privilege to care for you at your most vulnerable moments while you are under anesthesia. I am a registered nurse anesthesiologist, and I also teach the future of our profession and make sure that future generations of nurse anesthesiologists will be there to care for our aging and changing population.
My name is Elizabeth Tomaszewski, and I am a nurse who empowers other nurses through fostering critical thinking and empathy as a graduate nursing educator and a practicing critical care nurse practitioner.
Hi, my name is Lisa Miranda. I am a nurse who creates and oversees evidence-based content to support nurses at the point of care. I am a nurse who supports and mentors nurses in developing manuscripts for publication.
Hi, I'm Denise Hayes. I'm a nurse who helps nurse colleagues stay up to date through nursing journal articles. I enjoy teaching BLS and ACLS, and I'm very proud of my daughter, Kimmy, who is also a nurse.
I'm Colette Hendler. I'm a nurse who uses my expertise in critical care and infection prevention to lead a team in developing evidence-based resources for nurses that help improve patient outcomes.
Hi, I'm Casey, and I'm a nurse. I'm a nurse, and I inspire others by being a clinical instructor, and I also inspire others to seek certification, working in critical care from everywhere from when you come into the emergency room all the way to the ICU and in between as a critical care ground transport nurse.
Hi, my name is Denise Felsenstein. I am a nurse that contributes to the nursing profession as a nurse planner by providing management and accreditation for nursing continuing education programs for professional nursing journals. As an adjunct lecturer, I teach courses for students at a liberal arts college, which have included the topics of nutrition, drugs and alcohol, and stress management. Many of the students that I have taught have chosen to enter nursing school after graduation from the college. I also provide women's health care as a nurse practitioner by volunteering my time at a community clinic, providing care for individuals without health insurance.
Hi, I'm Marianne, and I'm a nurse who takes new recommendations based on the latest evidence and conveys this information to nurses through my work.
Hello, I'm Sean Kennedy. I'm the editor-in-chief emerita for the American Journal of Nursing, and I am a nurse. And through my work as an editor, I advocate for nurses, for the voice of nursing through the written word, multimedia, and social media. And I make nurses' work visible to colleagues, the broader healthcare community, and to the public.
Hi, my name is Myrna Schnur. I'm a nurse who has applied my clinical knowledge to a variety of settings, including critical care, information systems implementation, pharmaceutical research, medical simulation training, and most recently, writing and editing online content that educates and impacts nurses in every field.
Hi, I'm Edie Brous. I am a nurse. I'm also an attorney in that order, and I represent nurses who have legal problems with regulatory agencies such as nursing boards and departments of health. And it is my experience as an attorney representing nurses that nurses are not getting the information they need to protect themselves, to protect their livelihood, to protect their license, all the information I've learned as a lawyer that I never knew when I was in clinical practice. So my mission is to preserve nurses' livelihoods and make sure they're educated to the extent that they need to be to protect all those credentials that they've worked so hard to earn.
Hi, I'm Lisa. I'm a nurse. I'm a nurse who contributes to the learning and professional development of nurses and who volunteers in my community at a nurse-run clinic and our public health department.